The Alameda County Community Health Record, or CHR, is a secure, convenient hub for sharing information about Alameda County Care Connect consumers and about their care. Built into that hub is the Information Sharing Authorization, or ISA, a form which consumers sign to allow sharing of their medical, mental health, housing, and social service information with their care team members where it cannot already be shared by law. Care team members are all providers who work with a consumer, such as a medical provider, care or case managers, and housing navigators. When the consumer signs the ISA, care team members who have, or who will be working with the consumer can better coordinate his or her care. What does the Information Sharing Authorization do? Consumers' information is held safely and confidentially in the community health record. Without a signed ISA, some information can be shared, but only medical and mental health information, and only among those providers who are covered by HIPAA and who have a treating relationship with that consumer. But once the ISA is signed, housing and social service information can be shared with medical and behavioral health providers, and certain medical and mental health information can be shared with non-HIPAA covered providers with whom that consumer has a care relationship. Consumers are not required to say yes to the ISA. They can still receive services if they say no. Also, if they wish to limit sharing of mental health or HIV information, there is a checkbox on the form to indicate that. The Information Sharing Authorization only needs to be signed once and will be good for a year. What is the benefit for the consumer of signing the ISA? Signing the ISA will allow consumers to share information among multiple of their providers without needing to repeat themselves or carry the information with them from place to place. When consumers sign the ISA, providers will be better able to understand which other organizations the consumer is working with, as well as what other programs and benefits he or she might be eligible for. This will open opportunities to better coordinate between organizations where the consumer gets his or her care, and will clarify who to contact at other organizations should the consumer need additional help or information. For example, a feature of the CHR is the ability to upload documentation to share with other providers or to store for the consumer. Often, a consumer will start a document with one provider, need to follow up with another provider to complete it, and then bring it back to the original provider. With a signed ISA, providers can upload documents to share and complete without requiring the consumer to carry the papers back and forth. This is one of many examples where you, as a provider, will be able to see and share information from and with other care providers to better coordinate care for your consumers once they sign the ISA.